Welcome to a deep dive into the fascinating and often overlooked world of our kidneys.
That's right.
We're going to uncover what happens when these essential organs face challenges, specifically with AKI and CKD. So, acute kidney injury and chronic kidney disease.
Yeah, it's amazing how these organs just quietly do their jobs day in and day out,
Right.
filtering our blood, keeping things in balance.
Yeah.
And then, when something goes wrong,
Yeah,
that's when understanding AKI and CKD becomes crucial.
for sure. I have this nursing study guide right here in front of me. It's packed with information. It's got stages and symptoms and treatments, even dialysis. Um, so I guess my first question is, where should we even begin?
Well, imagine your kidneys are kind of like a high-tech filtration system.
Okay.
And when they fail, either partially or completely, it disrupts the body's very delicate equilibrium, and it really impacts practically every system.
Wow.
Yeah.
It mentions BUN and creatinine as key indicators of kidney function.
Right.
What is the significance of those?
So think of them like the alarm bells.
Okay.
They're waste products that healthy kidneys typically filter out efficiently. So if you've got elevated levels in your blood, that's the body's way of saying, hey, something's off with the kidneys. We need to take a look at this.
Okay, that makes a lot more sense. So then what is the difference between AKI and CKD?
Okay.
Are they just different degrees of the same problem?
So they both involve kidney failure, but their timelines are dramatically different.
Okay.
AKI is like a sudden earthquake.
Oh, wow.
It's a rapid loss of kidney function over a very short period of time.
Okay.
CKD, on the other hand, it's more like a slow, creeping change in the landscape.
Okay.
It's a gradual decline that's often silent in its early stages.
Oh, wow. So with AKI, is it possible for your kidneys to be fine one day and
Yeah.
then like failing the next?
It can feel that sudden,
Yeah.
especially with how quickly symptoms can arise.
Wow.
So let's say someone gets really severely dehydrated.
Okay.
The blood volume drops. It causes a traffic jam of sorts,
Okay.
restricting that blood flow to the kidneys.
Oh, wow.
That's a classic example of what the guide calls pre-renal AKI, where the problem isn't the kidney itself,
Okay.
but something upstream affecting its blood supply.
Interesting. This study guide mentions acute tubular necrosis.
Yeah,
It sounds intense.
it is serious.
Oh, gosh.
So imagine tiny filters in your kidneys called nephrons.
Okay.
ATN is when those filters get damaged.
Oh, no.
Like toxins, infections, even some medications.
Oh.
When those filters can't do their job, waste products build up and things can go downhill really quickly.
So pre-renal AKI is like a blood flow issue, and intrarenal, like ATN, is damage within the kidney itself.
Exactly.
That leaves postrenal.
Precisely. Picture a blocked pipe.
Okay.
Postrenal AKI is like that. Something's obstructing the urinary tract,
Mhm.
preventing urine from draining properly.
Yeah.
Think kidney stones, tumors,
Oh, God.
anything causing a backup in the system.
So we have these three pathways to AKI. What stood out to me was how untreated AKI can sometimes lead to CKD. That's a scary thought.
Yeah, it is. It highlights the importance of prompt diagnosis and treatment. While AKI is often reversible,
Okay.
if it's not managed effectively, it can sometimes cause lasting damage. Imagine a wound that heals with scarring.
Okay.
Those scars can impact kidney function in the long run, increasing the risk of developing CKD later on.
So it's interesting, though, that the guide emphasizes diabetes and hypertension as like the leading causes of CKD. That
Yeah.
seems like a completely different pathway.
Absolutely. Think of it this way. Those chronic conditions, if they're not managed well, they're like wear and tear on your kidneys over time.
Okay.
High blood sugar, high blood pressure puts a strain on those delicate filtering units, and over time, that stress can lead to CKD.
So with AKI, it's often like a sudden event, whereas CKD is more of a slow burn.
Exactly.
The guide also breaks down AKI into different phases.
Right.
What are these phases all about?
Well, before we get there, let's consider for a moment what a dramatic impact a declining kidney function has on your entire system.
Oh, you're right. This isn't just about your kidneys. It affects everything.
Exactly.
I'm ready to learn more. What should we explore next?
It's fascinating, isn't it? The kidneys have such an impact on, so many different bodily functions.
Right.
For example, did you know that they're actually responsible for activating vitamin D?
Really?
Yeah, which is, as you know, crucial for strong bones.
Right.
With CKD, that process is disrupted,
Oh, wow.
which increases the risk of bone fractures.
Wow, I had no idea that was connected to the kidneys.
Yeah.
Okay, what other surprises are lurking in this guide?
Uh,
What about these different phases of AKI?
Yeah.
It mentions an oliguric phase, which sounds kind of ominous.
It can be.
Yeah.
The names might sound a little technical, but they tell a story.
Okay.
Picture this. You're dealing with AKI, right?
Right.
And suddenly your urine output just plummets.
Okay.
You're barely producing any urine.
Yeah.
That's the oliguric phase.
Oh, wow.
Usually happens within the first week of the injury.
Okay, so that's a red flag.
Less urine means the kidneys aren't doing their job.
Exactly. And remember those alarm bells we talked about? BUN and creatinine?
Right.
They start going haywire, along with potassium levels.
Oh, no.
Waste products start to build up, which leads to a condition called metabolic acidosis, which
Right.
basically means your blood is becoming too acidic.
Oh, gosh.
And that can impact various organs.
That sounds like a dangerous situation. What happens next? Does it plateau there?
Not quite.
Okay.
The guide then talks about a diuretic phase.
Okay.
Now, you would think more urine means things are getting better, right?
Right.
And in some cases, it is a sign that the kidneys are trying to recover.
Okay.
But,
But there's always a but, isn't there?
well, with the kidneys still not at full power,
Okay.
this surge of urine output that you're seeing can actually be deceptive.
Oh, wow.
It can lead to dehydration and electrolyte imbalances if it's not carefully managed.
So it's like a tightrope walk.
Too little urine, problem. Too much urine, a different problem.
That's right.
And then there's the recovery phase, which sounds much more hopeful. Is that the all clear signal?
It's definitely the light at the end of the tunnel.
Right.
Kidney function is gradually improving.
Okay.
Those alarm bell markers that we talked about, they're starting to normalize.
Yeah.
But the guide makes a really crucial point.
Yeah.
Full recovery isn't always guaranteed.
Right. And this is where we worry about long-term damage.
Exactly.
The potential transition from AKI to CKD.
Exactly. Just like any injury, sometimes there's scarring.
Right.
And that scarring can unfortunately lead to CKD down the line.
Okay.
And speaking of CKD, it's not a one-size-fits-all diagnosis either. The guide mentions 5 stages.
5 stages. That seems like a whole lot of nuance for one condition. How do those even work?
It all comes down to how well your kidneys are filtering waste,
Okay.
specifically something called your glomerular filtration rate,
Okay.
or GFR for short. Think of it as your kidney's efficiency rating. The higher the number, the better they're working. A normal GFR is usually above 90.
So a lower GFR means your kidneys are struggling.
Exactly. Each stage of CKD corresponds to a lower GFR range,
Okay.
indicating progressively worsening kidney function.
So the insidious thing about CKD is that early stages often have very subtle symptoms. So people might not even realize that anything is wrong.
Exactly. And that's
scary. So you might not even know your GFR is dropping until you're in a more advanced stage.
why early detection is so vital.
Right.
Especially if you have any risk factors like diabetes or high blood pressure.
Okay.
Because as CKD progresses, the symptoms become much harder to ignore. It starts to affect virtually every system in the body.
The guide lists a whole bunch of symptoms like fatigue and swelling and nausea. It's a pretty extensive list.
Yeah, it really highlights how interconnected our bodies are. Remember we were talking about electrolyte imbalances before.
All right.
CKD can lead to high potassium levels or hyperkalemia, which can cause serious heart rhythm problems.
This is where it gets really impactful, right? It's
Yeah.
not just about the kidneys anymore. It's about the domino effect on the entire body.
Exactly. And then you've got the buildup of waste products in the blood,
Right.
which leads to a whole host of other issues. Remember metabolic acidosis.
Right.
That's a big one with CKD as well.
Okay, so early detection is clearly essential here.
Yes.
But how do we even know to get checked?
Right.
What kind of tests are we talking about?
Well, a lot of times it starts with a simple blood test
Okay.
just to measure those BUN and creatinine levels.
Right.
Those are our red flags, right?
Right.
If those levels are elevated, further testing might be needed.
Okay, what comes next?
Well, it depends on the individual, and their medical history.
Okay.
Your doctor might order a urine test to analyze the content of your urine,
Okay.
looking for things like protein or blood, which can be early signs of kidney damage.
What about like those imaging scans that we often hear about, like ultrasounds or CT scans?
Yeah,
Do those play a role here?
absolutely. Those imaging tests can provide kind of a visual roadmap of your kidneys
Okay.
that can help doctors identify any structural abnormalities or blockages or any other issues that might be contributing to the problem.
It sounds like diagnosis involves kind of piecing together clues from different tests to get like a complete picture.
Exactly.
So once we have that picture, how do we address these conditions?
Well, the approaches to AKI and CKD are very distinct,
Oh,
each
yeah.
with its own set of strategies and goals.
Right.
And that's precisely where our nursing guide takes a deep dive. It outlines various treatments and management strategies.
This is fascinating stuff.
It is.
But before we delve into those treatment options,
Okay.
let's take a quick pause.
Sounds good.
We'll be right back. And we're back,
Back again.
ready to explore the world of treatment options.
That's right.
I have to admit, this nursing study guide has been quite the eye-opener.
Yeah, it's true.
Yeah.
Knowledge is power,
Right.
especially when it comes to our health.
Sure.
So where did we leave off?
Um,
Yes. Treatment strategies for AKI and CKD.
right. And the guide gets pretty detailed about dialysis,
Okay.
specifically two main types, peritoneal dialysis
Mhm.
and hemodialysis.
Hmm.
What is the difference between the two?
So both of them, the goal is to do what healthy kidneys do,
Okay.
which is to filter the blood and remove waste products.
Okay.
But they achieve it in very, very different ways.
Okay.
So peritoneal dialysis is actually remarkably innovative
Okay.
because it uses the lining of your abdomen, the peritoneum,
Okay.
as a natural filter.
Wait, your own body acts as a filter.
It does. It's pretty amazing.
How does that even work?
So it involves a surgically implanted catheter in the abdomen,
Okay.
and a special solution called Dylinary is infused into the peritoneal cavity,
Okay.
and waste products move from the blood vessels into this solution. And then that dialysate, which is now carrying all the waste,
Right.
is drained out.
Oh, wow.
So it's like a fluid exchange
Oh.
that's happening right inside you.
So it's literally cleaning your blood internally.
It is. It's really quite fascinating.
That's wild. And the guide mentions this can be done at home.
That's right.
That's amazing.
Yeah, that's one of the significant advantages of peritoneal dialysis.
Right.
Is it allows for a lot more flexibility and independence.
Sure.
It really empowers individuals to manage their treatment at home or even while traveling, after they've had the proper training, of course.
Right.
But yeah, it can be done.
That sounds much more convenient than regular hospital visits.
Absolutely.
So what about hemodialysis then? When is that like the preferred route?
So hemodialysis is often necessary when kidney function is significantly compromised.
Okay.
It's a bit more involved.
Okay.
It requires a specialized access point, usually in the arm,
Okay.
to draw blood out of the body. And that blood is then circulated through a sophisticated machine called a dialyzer.
So if peritoneal dialysis is using your body as a filter, hemodialysis relies on an external filter?
Precisely.
Okay.
So the dialyzer contains a special membrane that acts like a high-tech sieve.
Okay.
It allows waste products and excess fluids to pass through
Okay.
while keeping the essential blood components in.
Right.
And then that filtered blood is then returned to the body.
So the guide mentions that this requires regular clinic visits, which makes sense given the complexity.
Yes, typically 3 times a week,
Wow.
with each session lasting for several hours.
Oh, wow.
So it does require a bit more planning and can disrupt daily routines,
Right.
but it does allow for close medical supervision,
Sure.
ensuring that the treatment is really tailored to the individual's needs.
This guide even mentions a CRRT, or continuous renal replacement therapy. That sounds pretty intense.
It sounds intense because
Yeah.
CRT is basically a specialized form of dialysis that's typically reserved for critically ill patients, often in intensive care units.
Oh, wow.
So unlike conventional dialysis,
Okay.
which happens intermittently,
Right.
CRRT provides continuous 24/7 blood filtration.
So it's like having a constant cleaning crew working around the clock
Exactly.
to keep things running.
Exactly.
Wow. That's amazing.
It's a much gentler approach,
Okay.
which is essential for those with unstable conditions.
Right.
It helps to maintain a more stable internal environment for them.
Wow. We covered so much ground.
We did. We really did.
From understanding how our kidneys even work
Yeah.
to the intricacies of AKI and CKD, and now these remarkable treatments that are available.
Right.
This has been quite the journey.
It really highlights the incredible advancements in medicine
Absolutely.
and how important early detection and ongoing management are in mitigating the impact of these conditions.
Absolutely. And remember, this deep dive was just a starting point.
That's right.
If you have concerns about your own kidney health, reach out to your doctor.
Please do.
They are your best resource for navigating those concerns.
Absolutely. Your health is an ongoing conversation, and staying informed is key.
So until next time, keep those questions coming
Yes.
and keep exploring the fascinating world around us.
Absolutely.
Happy learning.